Welcome to Step Up with DL Walker. At any time during our live vidcast premiere, you can ask questions of myself or our guests by typing your question in the box called Top Chat, located in the right-hand corner of your screen. If you're watching a recording and have a question, just type your questions in the comments box below, and we'll be sure to respond. At any time, check out the information box because it contains contact information and special offers from DL and our guests. That's located underneath this video. Enjoy the vidcast, and if you find this information helpful, please give it a like and share it with anyone whom you feel may benefit. Thanks so much for watching, stepping up for your health, and please do be in touch. And today my guest is Dr. Anna Marie Wysynski, fondly known as Dr. Wyzz. She is a Toronto bioidentical hormones doctor, and she works at the Spa Vitality Anti-Aging Wellness Center of Toronto, where she provides advanced bioidentical hormone replacement therapy programs to men and women who are suffering with the symptoms of hormonal imbalances. Over the years, she's helped thousands of men and women in Toronto in their efforts to lose weight and achieve their goals of obtaining a slimmer, healthier body and overall improved self-esteem. These are people much like you and I who, before coming to her, had tried everything from the so-called miracle creams and pills found on the internet to countless other home remedies, gadgets, and diets of the day that are found in glamour magazines and popularized by. She's been able to change all that thanks to her surgery-free medical programs for looking great and feeling great at any stage of life, whether you're in your 30s, 40s, 50s, or beyond. And today, she's going to share her wisdom on estrogen dominance. Thank you so much for being here. Welcome, Anna Marie. And Anna Marie, first questions first. Tell us what exactly estrogen dominance is.
So estrogen dominance is an unnatural state of hormone balancing in women's biochemistry. When we are younger and we are in our early to mid reproductive years, progesterone, the other female hormone, I'll talk about that in a sec. The other female hormone, progesterone, is multiple times higher than estrogen when we're in our early reproductive years. We've heard the old wives' tales, have your babies around age 25 because it'll be an easier pregnancy, no stretch marks. We also know that once women hit 30 and especially 35, fertility, delivery, complications, fertility declines, all those complications go up. This is an indication of the early shift of that progesterone estrogen balance. So our grandparents and those wives' tales were not necessarily tales, they're actual reflections of what happens in our biochemistry. So somewhere in our mid 30s, which is approximately midway in our reproductive lifetime, we start seeing a shift. And then as we progress to perimenopause, which is before we lose our periods, menopause is that anniversary day of our last menstrual cycle. When we march towards menopause, we start seeing the hormone balancing flipping. So both hormones decline, progesterone and estrogen, in perimenopause or in the mid to late reproductive years. And then we find that estrogen declines less so than progesterone, leaving estrogen higher in concentration or ratio than the progesterone. And that's what we term estrogen dominance.
So what are some of the symptoms that can be associated with estrogen dominance?
Great question. So when we think about perimenopause, that sort of tempestuous turmoil in women's lives, it can be very individual and it can range from virtually nothing to very severe. Less than 20% of women going through perimenopause and menopause will have no symptoms. So that means the majority of us will definitely have symptoms like abdominal bloating, flatulence or gas, swelling, tenderness of our breasts. Many women's breasts become more like watermelons, very heavy and enlarged, engorged, and very tender. Lumps in the breast that are not cancer, changes in sex drive and sexual interest, change in sexual function, so vaginal dryness, painful intercourse. We can see in menstruating women very irregular menstrual periods. So typically the menstrual period duration will shorten. So more frequent bleeding, more heavy bleeding, much more clots. Some of my patients said, yeah, I just dropped a chunk of liver on the floor last night in the bathroom when I was getting ready for bed, as for an example. Or people filling the bathtub with red water because they're bleeding so excessively. We see premenstrual syndrome being more accentuated. So that bloaty, fatigue, headachy, achy, irritable, moody, very volatile, explosive tempers in that time period. We see headaches, anxiety and depression, panic attacks, weight gain, especially in the middle or around the hips, the saddlebags type thing, hair loss, body temperature changes, sleep problems, the proverbial on and off covers of the hot flashes and night sweats, the ruddy sweating, the drenching sweats, memory problems, appetite changes, joint and muscle aches and pains. There is nothing that our sex hormones really don't affect. And we could go on and on. There's probably, I think at last count, looking at about 62 symptoms of perimenopause, which are basically driven by the estrogen dominance.
So in fact, is perimenopause the same as estrogen dominance? Can they be used interchangeably if somebody is having the quote unquote, if they are the 80% of the people that are having symptoms of perimenopause, is it due to estrogen dominance or can it be due to something else?
Great question. So the perimenopause is that up to 10-year period prior to the loss of the menstrual cycle, the 1-year anniversary of the menstrual cycle loss. And so perimenopause, I imagine, could be interchanged with estrogen dominance. We don't usually think about it that way, but that's a great connection because perimenopause is usually when those hormones are really shifting and the decline is really happening at a rapid rate, which results in estrogen dominance. So depending on where one is in the hormone shifting, they may not truly be estrogen estrogen dominant, but when they get to be imminently or close to being menopausal, the closer they are to their menopause date, then we find that the estrogen dominance is definitely there.
And what age are we talking about on average? And does it range from culture to culture?
Great question. So the average age of menopause in North America is 51.1 years currently, but the symptoms of perimenopause can happen up to 10 years earlier. But really, menopause can actually occur as early as age 35.
Mm-hmm.
In most cultures worldwide, the average age of menopause has been around 50 years old. And yes, some cultures like the Japanese and Chinese, the Asian cultures, where they tend to not even have a word for menopause in their vocabulary, they tend to have less chance of having symptoms. Although the changes still naturally occur, I think that there are some differential factors from culture to culture and country to country that actually help to maybe mitigate the effects of estrogen dominance.
So are there cultures that have less perimenopausal symptoms that you're aware of?
Yeah, so in Asian cultures, particularly China, a very minor number of women will experience menopause symptoms. And as I said, in that culture in China, they have no word for perimenopause. There is no such thing as words for the change of life, as we call it here in North
Interesting.
America. Mm-hmm.
I find that fascinating, actually, because I almost feel sometimes that when you have an event, sometimes it can be almost a self-fulfilling prophecy. And that's just my take on it or belief. Like, for example, many people read the book, What to Expect When You're Expecting.
Right.
I did not read it at all because I did not want to have it in my mind that this was going to happen.
Right. Right.
So that's very interesting to me, and I just thought I'd bring that up. So, well,
can I give a personal experience to corroborate what you've said?
Oh yeah, absolutely. Please.
I think that manifesting, from a spiritual aspect, I think manifesting is a really important concept to consider. Mm-hmm. Also, mindfulness and manifesting are very much connected. And we know that there's a psychosomatic component to most states or illnesses, or what we medicalize as an illness. Really, menopause is not an illness. It's a rite of passage. It's a physiological transition time. But because it's become so bothersome for women, some women commit suicide in menopause, that we've medicalized it to try and manage it to reduce symptoms. And so you're right. I think one's experience around menopause, and unfortunately, as a menopause expert and a hormone expert, I'm really frustrated that we don't talk about this. It's really taboo in North America and worldwide. We don't prepare women to say, you know what, this could be a really tumultuous time in your lifetime. And then all of a sudden we find ourselves in it. As a young woman, I developed very early. I started into menarche around age 10. And I was really blessed in many respects that my mom, with a grade 8 education, had such a great attitude towards menstruation and that womanhood, that rite of passage of coming into womanhood. And she encouraged me to look at it as a positive thing. And I think that very much may be part of the motivator for me to be a woman's advocate at this point, because if we expect that we call it the curse or, that time of the month or the rag, yes, we have all those colloquial sayings about it. Some of those are very derogatory, and yet we know that the psychosomatic aspect of this doesn't mean that we make it up. It means that our belief system influences the disease or the illness experience or the state experience. And I think having a positive attitude about it can be very helpful. I also think the difference maybe between North America and China, for example, with respect to menopause and the symptoms, is that in the Far East, age is very much revered. Wisdom, life experience, looking towards elders as wise Sherpas, maybe. We're here. Here, a woman in menopause is considered an old chicken that can't lay eggs anymore and is heading for the stewing pot. Right? Very difficult, she's all washed up. She's not valuable anymore. And I think going into these transitions with these conditioned messages is difficult to break out of. I think women also go through a grieving process where they lose their sense of femininity or youthfulness, which is not really true, because really now in this day and age, 65 is really when middle life starts, and we haven't really acknowledged that as yet, especially with women's health.
Interesting. When you also bring up, and I wanted to ask about this as well, because it almost seems, particularly when women are giving birth at later ages. So absolutely. I gave birth to my daughter at 39 in a couple of months.
Yes.
It almost seems like you go right. Does that influence or accelerate the symptoms of perimenopause? Or is it just a coincidence that they can occur simultaneously, pretty close together?
Right. Great question. So there's no specific scientific data to support that, but there is a trend. So we know that the age of menarche, or going into puberty for a woman, can be correlated with her menopause age. So typically, the more delayed the onset of menopause, menarche, the more delayed, so into early teens, 16, 17, 18, the menopause will come earlier. If somebody has started earlier or on time, there's a better chance that they will go to 50 or beyond with their menstrual cycles. When we get into later pregnancies, and this has been a trend for decades in North America specifically, when we see women having their babies at 30 and beyond, we know that there hasn't been a pause in the hormone cycling. The pause of pregnancy and having sole pregnancies versus multiple pregnancies has also contributed to the hormone imbalance. So when there is pregnancy, it takes a pause on our natural cycling. It is actually protective for diseases like breast cancer, but it also actually pauses and preserves eggs. So the more ovulatory cycles we have without pregnancy early on in our youthful years, there is a thought that we run out of eggs in menopause. We don't really run out of eggs, but we run out of the communication between the ovaries and the brain because things are naturally winding down. We used to die before we were 45. Now we're living well into our 80s. So as we progress through that later pregnancy, 30 and beyond, especially 35 and beyond, now we've sort of run the gambit of many menstrual cycles. We have this pregnancy where there's a pause in the hormones. And when women rebound from a later age pregnancy, the progesterone, which drives the menstrual cycle, doesn't always rebound. So if they have a decline or delayed resumption of some progesterone, they can start going into perimenopause for sure.
Yeah, I know the people that you're speaking about or speaking to with this. So let's now talk about what can be done for these people who are suffering.
Absolutely. So attitude can be one thing. And I don't mean to say, suck it up and get over it. That's not my approach. But looking at this as a transition time, I call this the second puberty, or, the Tempest. I don't know why I associate it with Shakespeare's The Tempest, but it just seems quite apropos for women because most of us will have symptoms, and some will be mild, some will be moderate, some will be severe, and some will be superlatively severe, that some women are just their quality of life, they really have no quality of life. So attitude one. Number two is very focused self-care. So making sure that we give ourselves the rest that we need, making sure that we take time to pause, making sure that we take time to eat properly. So diet is influential, attitude is influential. Even in terms of doing things that are pretty simple, like avoiding contaminants that look like estrogen. So for example, watching our cosmetic products, many of them have estrogen or hormone mimics in it. Looking at pesticides and environmental chemicals, because these are what's called persistent I'm just drawing a blank here, persistent hormone disruptors. So they are persistent, biopersistent, that they don't ever leave our body, and yet they can damage our hormone communication. I love this. I was just talking with T.S. Wiley, who's the founder of the Wiley protocol, a certain approach to hormone replacement. And she used this terminology that I asked permission to borrow from her. She said, hormones are biological programming. So if we have exogenous things or things that come from outside of our body, like pesticides and chemicals and perfumes and additives that are jamming up our biochemistry, and they don't go away because they can't be easily metabolized out, they're sending wrong programming. We would never allow our computer to be going down a wrong pathway or decision tree, or our car. So why would we allow our hormones?
It's almost like a virus in our hormones.
Exactly.
Like a computer virus.
Absolutely. Not a virus like you would catch, but you're right. No, just like a program virus or something that is acquired, right?
So, So how do we know, obviously most people know about organic foods and the pesticides and that kind of thing. But, again, when you're thinking, obviously deodorants, shampoos, makeup. Yeah, that's the big one. And certainly perfumes. So
body washes.
Soaps, yeah. Mm-hmm. Even sunscreen.
Absolutely. Even things like feminine hygiene products.
Like tampons?
Absolutely. So there are chemicals that are used, chlorine to bleach, et cetera, Clothing, certain fibers of clothing. I love microfiber, but it's basically a recycled plastic bag from the grocery store. Plastic is persistent. We have all kinds of issues with that, right?
I like that. Plastic is persistent.
Household cleaners. Household cleaners are a big one, a huge one. I was shocked many years ago when I found a Swift cleanup product for our floors, to find out that it was absolutely toxic to pets, because they would get the dried residue, lick the residue off their palms, and then it would destroy their livers. So that product went out of my house very quickly, partly because of my pets. But I thought, wow, if it's contaminating them, what's contaminating me? Right?
Absolutely. Interesting.
Drinking water is a huge source of contamination. Faucet water, or as we say in Canada, tap water. Filtering water can be very beneficial. We know that in years and years ago, there was a study done in major cities across the US where drinking water was sampled, and there are therapeutic levels of pharmaceutical drugs in the water, birth control pills, high blood pressure pills, antidepressants, because we urinate them out of the metabolites, we incompletely absorb them, and then when we're drinking water, we're getting therapeutic exposure to ththose compounds.
Wow. So that's going to be a huge thing or maybe, something that we could really kind of take advantage of. So some of the things that I do, vinegar and water for cleaners.
Yes.
There are obviously filter your water.
Yes.
Again, be mindful of your products, or make them at home from natural ingredients. And, these are all things that can be found on the internet, as far as recipes and those kinds of things, and looking up natural alternatives to avoid exposure to these things. The clothing I was not aware of, but obviously then 100% cotton would be important. Certainly the
Also important
feminine,
for symptom control.
yeah, and then certainly feminine products. Like I started using a Diva cup
Yes.
rather than tampons or pads.
Awesome.
Yeah. So, and that's environmentally friendly as well.
Absolutely.
So that, that is again, kind of something that I've been doing because I had all, many of the symptoms that you had spoken about.
Yes.
With regard to bloating and the breast tenderness and the, water, weight gain around the midriff and, and all of, and all of those things. And I too had, like I mentioned earlier, had my daughter late in life. And I think I went literally from pregnancy, breastfeeding to perimenopause.
Wow.
Symptoms without even kind of being aware of it.
Right.
So to speak, because I never rebounded fully from the pregnancy, or I did for like a minute. And then I happened to have like literally a minute, maybe a month. And then I happened to have an exorbitant amount of stress in my life. And I think it's also important to say, one of the things that you had mentioned was about, self-care. And how does a woman who is, who has the child later in life, and then they have young children, deal with perimenopause?
Even women who have had their children around age 25, if you've got a 15-year-old woman, especially in your home, who is menstrual, bitchy, hormonally volatile in their moods, we've all been pubertal. How are women in their late 30s, early 40s coping with that young woman who's 13, 14, 15, who is also testing the boundaries of her adulthood, that dress rehearsal for adult independence? It's kind of crazy making. I think a lot of women also don't allow themselves the esteem of counting because we've been socialized that way, but also we're programmed that way to give. In our association, DL, you and I both have used sayings or quips. That saying is, you cannot serve from an empty vessel, right? And women often are operating at high speed and overdrive with an empty vessel. So doing things like carving out boundaries and making them non-negotiable, even for 10 minutes a day. So one of my own insights, prior to where we are right now with COVID, one of my insights for me was I enjoy vocal music and I was taking lessons, and that time became sacrosanct. It was non-negotiable. Even my husband noticed how beneficial it was to me to have my lesson. Each second weekend, we would have a group lesson called a master class. And if somebody emailed or called for a social event on that time, he would say, "No, I'm sorry, Anna Marie's not available, but we could do it on Sunday or another day. Would you prefer to do that?" And he would help me make that time period sacrosanct. Also, just small things like 10 minutes once or twice a day. I often tell my women, especially if they're working outside of the home who need to get into dress wear, you're going to go upstairs. Most women will go upstairs to change into their house clothes or something more comfortable after the work day. Why not just close your door and lie in your bed for 10 minutes after you come home? Listen to some binaural beats or listen to some symphony music. Those are very scientifically proven to be beneficial. Do some deep breathing.
Yeah,
right?
That was going to be the thing that I was just going to say is
freshen up your makeup. It doesn't take that long. Or executives, I tell them, put your phone on hold, or even if you have small children, have a rule that when the bathroom door is closed, it's privacy time. And so mommy can just actually go to the bathroom to eliminate in peace, knowing full well, yes, if you have a toddler that can't speak or can't problem solve, that maybe pose a difficulty. But by the time kids are 2.5, they know privacy. And as long as they know to knock on the door and they're capable of knocking on the door if there's an emergency. And I think our reframing of what constitutes an emergency, driving through your local coffee place and not getting your coffee in 37 seconds is not an emergency. And reframing values. Also, John Lee, who is one of the physicians who years ago started this concept of bioidentical hormones and started using them as a replacement method during this perimenopause, menopause time. I can't quote him directly, but I remember the essence of his quote being that in menopause, women come into their own. They start valuing themselves, and
Yeah.
they start taking a place of value in the world, and they start to find their voice. So where we would normally bite our tongue or put ourselves second, we start finding our voice. It causes conflict sometimes because the usual interactions or dynamics change, but women start asking what they want and demanding some degree of respect. And first of all, it comes with self-respect. And I always say it's not about self-care. For me, self-care, whether it's doing your makeup, having a massage, doing your nails, getting your hair, whatever that self-care looks like, boils down for me as a positive act of self-compassion. That's huge. It is
Yeah.
self-compassion, and self-care is a way of expressing that self.
I like that, because, some people might think or might have it in their mind, self-care being selfish. And I like self-compassion because it is being compassionate to yourself. And, some people don't ever, they ignore the symptoms. So I think maybe the body is saying to them by the symptoms, hey, listen, you need to make these changes in your life, or you're just, the next 10, 20, 30 years, the second act is going to be very, very difficult for you. And if you're not willing to do this now, you're never going to do it. So, if we set up those boundaries ahead of time, maybe it would have been a lot easier. But, somehow, again, we were never taught these things. And menopause, I think, or perimenopause, is a great lesson. I always felt that menopause kind of stood for meant to pause. Literally.
I love it. Yes, and there's just a T missing, meant to pause.
To pause, yeah. Meant to pause. And
I love it. Can I borrow that?
Absolutely. Absolutely. And really kind of, think about what you want that second act to look like.
Right.
And again, I love that we brought up about the, potential negative connotations about associations. I do believe that that's a huge thing. So any last bits of advice, something you would tell a woman who might be going through this that we haven't mentioned already?
Absolutely. So 2 things I want to incorporate into that advice. Many women, I'm actually surprised, but maybe not so much. So many women don't even understand that some of the symptoms that they're experiencing are due to their hormones. They have no idea that what they're feeling, like this craziness, the bitchiness, the flying off the handle, can't think, can't problem solve, can't sleep, are related to their hormones. So if in question, ask, inquire. The other thing is, when women's hormones are changing, we always think that it is about the body, the hot flashes, the night sweats, the dry vagina, our brains change. And many women have difficulty with cognition or thought, as well as problem solving. And sometimes you can't problem solve if the soup that bathes your nervous system and creates your thoughts is soured or off seasoning, right? So by giving ourselves that self-compassion and asking for help is really important. I'm really disturbed that the Victorian thoughts of menopause or women's issues or women's mood swings are still about hysteria. So when you talk about the hysterectomy, the womb being taken out in the 15th century in Victorian era, they used to think that when women had premenstrual syndrome, if you took the uterus out, you would cure the hysteria, ergo hysterectomy. That's also rooted in the word for womb from Greek, but it really was a common thought about taking out the hysteria. So we have to debunk the myths and stop criticizing women. So instead of, the teenager in your house, when you're going through menopause saying, oh, you must be on the reg, let's stop the derogatory statements and then seek help. There's a lot of things that can be done. That my program, Menopausitive, is actually, Menopause 911 is focused on the non-pharmaceutical management of menopause. So our listeners could be watching for that as it launches in the future. Also, hormone replacement therapy can work wonders if that is something that a woman is interested in. As well, hormone replacement therapy, which I'm an expert in as well, has been shown to reduce all-cause mortality. So that's a very strong statement for what happens going forward when we replace our hormones. So the data now shows both men and women who are in that early middle age, around 50, if hormones are replaced for the respective genders, the reproductive hormones, that it reduces the risk of dying from all diseases. That's
Wow.
really strong. That's really strong. Also, when I started my functional medicine practice, I wrote an article for a local paper saying we would all choose to live to be 100, ... unless we're in a nursing home. And I think our biggest fear is as we go into menopause that we're all washed up and life is over. It's not. Life could be very fulfilling. And that's a time when we could really pursue our hobbies, our interests, formulate great interpersonal relationships. Rely on your girlfriends. Ask your mother if she's still around. If your grandmother's here, talk to grandma. Let's start having the conversation and opening up a dialogue internationally. That's my purpose for my Menopause 911 program, is to start opening up a dialogue. And let's really debunk the myths and then make great choices for self-compassion. And it starts with the basics. You build a house typically by putting some form of foundation, a slab or a basement, some structure. Get structure to our lives: regular bedtime, exercise, hydration, diet, stress control. Nobody wants to talk about stress. We all have it. It seems like another chore to add on to our daily routines, but really being able to stay present and centered and grounded is really important. Talk to those you love, gather them near, and have a really great lifestyle. That is a key of the basics. Those are the easier things to do. And we can all do those. Those are all choices we can make and have in our control. And to realize, one last thing, just realize that this is not inevitable. It is, sorry, I shouldn't say that. It is inevitable, but everything around menopause is not inevitable. We don't just have to resign ourselves and accept that that's just natural or the way it is. There are lots of options and probably more coming as medicine and alternative choices evolve.
Now, one last question, because you mentioned bioidentical hormones.
Sure.
Are they proven to be safe? When should they be considered? That kind of thing. That'll be my last question.
So bioidentical hormones are not like pharmaceutical drugs where there are these large randomized double-blind placebo-controlled trials. That's a lot of verbiage for the standard trial for approving a drug, because these are naturally based. So natural-based products that cannot be patented usually don't have these trials. However, there are decades and decades and decades of literature out there and anecdotal and group data. So at the end of 2018, there was a wonderful book published by a researcher, he's a physician named Avram Blooming, who went back, he was an oncologist in California, who went back to the 1940s and reviewed all the literature on estrogen only. I'm an advocate of balanced hormone replacement, but he looked at estrogen only, including the synthetic estrogens. And in his book, he talks about even the fact that women who are diagnosed with breast cancer, who are on traditional synthetic estrogen only HRT at the time of diagnosis, have more positive outcomes with the treatment for breast cancer, a reduced chance of recurrence. And if they have a chance of recurrence, it takes longer than if women are not on any HRT at all. So the Wyzz study, the Women's Health Initiative study that was stopped with synthetic estrogen and progestins, has a plethora of problems that have now been acknowledged in the scientific literature. Basically, the study should basically be taken off the literature books and thrown out. And even the primary researchers who have conducted that research have actually endorsed that there were huge problems with their study, but that study scared women so much worldwide that the therapies were stopped. Physicians are afraid because of that study, because they're still immersed in that flawed literature in prescribing and recommending hormones for women. So I think if one is to look at hormone replacement, either synthetic or bioidentical, which come from natural sources, working with a practitioner who's comfortable and well-versed in this area can be really beneficial, so that you could get, yes, we are biased in favor of hormones, so nobody is unbiased, but to get a different flair of people who are in the know of what this literature is showing and what these trends and studies are showing, these meta-analyses, so that we can actually give women informed consent. And that for me is really important, that women gather information, ask the questions and have a chance to get their questions answered, talk about these myths and maybe misconceptions around the therapies, including the pharmaceutical ones, including bioidenticals that are available, and then make their choice and work with their doctor to stay safe in terms of monitoring and ongoing changes as needed.
And I'm going to ask that you provide me with some resources that people can do their own research, so that they will have informed consent, and they can look into it themselves. And if there are any really good resources or questions that should be asked, or different things that about,
sure,
that could help educate an individual and give them knowledge, because knowledge is power. Absolutely. To have that conversation, and also where to go and what to look for. I think that would be wonderful. So I'd really appreciate that. And absolutely. I really appreciate you taking the time to give us this wonderful interview that was really packed with important information. And thank you so much for coming on and joining me.
DL, it's been an absolute pleasure. We've been talking about this for a while, and I'm so thrilled to be available for this information, so we could crack the shell of the egg, so to speak, for all of your viewers. And I look forward to an opportunity to do this again with you if possible.
I'd love to. All right. Thank you so much.
You too. Bye, DL.
Thank you so much for joining us today on Step Up with DL Walker. For any information about our guest, it'll be found in the box below this video. For more information on how you can recover from injury, restore vitality, and gain resilience from disease and trauma, all in the comfort of your home, click the link on the screen. Until next time, take good care of your body, mind, and spirit. It's the only true home that you really have.